back to another episode of Honestly Bilal. I'm your host, Bilal Ahmed, and I'm a fourth-year medical student at the University of Toledo. And this is Honestly Bilal, the show for the aspiring ophthalmologist, where I sit down and talk with medical students who are interested in ophthalmology, residents who are training in ophthalmology, and current ophthalmologists in the field today. My guest today is Dr. Nicolas Yannuzzi. He's a assistant professor of ophthalmology at the Bascom Palmer Eye Institute. Dr. Yannuzzi, thank you so much for joining me. We actually connected via a former guest of mine whose episode is coming out soon, Dr. Klufis. So it's nice to be with you, and can't wait to hear from you.
It's awesome what you're doing here. I've actually had a chance to listen to some of your episodes, and I was initially a very big fan of Sridhar's podcast.
Oh, yeah.
And as a resident and a fellow, I listened to it coming in every day when I was driving to work, and I caught a couple of your episodes, and you're doing a great job here. I think this is good, especially for people coming in now and applying during COVID and really not having a lot of information to go by. And actually, Klufis is a good friend of mine, and he was my resident when I was a medical student at Cornell. So he's a great guy to have on your podcast, a wise guy.
Yeah, super cool guy. And it's cool how we're all connected via this in this strange world right now. And, it's great to sit down with you and talk. So let's get started with your origin story here. So, you went to medical school up in New York City, and you kind of, I'm just kind of interested to see how did you find ophthalmology? Was it before medical school, or was it during medical school, or when did you find the field? And tell us about that.
Sure. Like many other people that go into ophthalmology, I actually had some family members who were involved in it, so I had some exposure to it. My dad's an ophthalmologist, and my brother-in-law is an ophthalmologist. I had finished high school, going into college, thinking about pre-med. I had majored in biochemical sciences in college, and my intention was to go to medical school. But kind of towards the end of college, I felt a little bit of burnout. Some of my interests varied. I was also interested in economics and finance, and I had done some summer internships in biotech and also VC. So I was looking to do something a little bit different. I ended up actually applying through the e-recruiting, which is just this way to go and find jobs straight out of college. And I really didn't know whether I was going to go to medical school, whether I would like the next step of just trying something completely different. But I knew I needed at least a break for some time. So I actually started as an investment banker at Goldman Sachs. I was doing healthcare investment banking for 2 years.
Wow.
So for some of your listeners, there are, a good amount of people that will go and do something different for a couple of years. Some people with the intention to go into medical school, so they'll do something more medical based, work for the Peace Corps, volunteer, do lab research, do some clinical research. But for me, I just kind of wanted something related, but quite different. And that was what it gave me, just some real life experience, basically. I was there for a couple years, pretty soon. Since I was there, I kind of realized it wasn't for me long term, but I had a 2-year contract. I want to finish it out strong. So kind of towards the end of that, I thought about my next steps, and I decided I was going to apply for medical school. I hadn't taken the MCAT at that point. Okay. So I had to take another year off, and I worked in a lab doing research at Memorial Sloan Kettering, kind of doing brain tumor biology research. I had a great mentor there named Ingo Mellinghoff, who was very kind to give me a position, given that I really didn't have much lab background except for what I'd done in college. And spent a year with him, really learned a lot about translational research. Was pretty inspiring seeing his dedication to research in brain tumor biology. And during that time, I also applied to medical school.
Wow.
When I got into medical school, I kind of harkening back to what I had done in the lab, I was kind of interested in tumor biology. So thought a lot about radiation oncology, thought about a career that was maybe split 80-20 in the lab, primarily. Also thought about neurosurgery, and kind of veered away from what my father and my brother-in-law had done. They were always good influences on me and good mentors for me, and they really enjoyed their fields. But I really felt like I kind of wanted to pave my own way. And for that reason, I kind of put ophthalmology aside. But as I went through some of the other fields kind of in third year, I realized that a lot of the things I liked were actually in ophthalmology.
Sure.
I had somebody tell me, which I thought was pretty helpful, just kind of distill what you like down into 3 general buckets, or a couple of things that you're really looking for in a career. And that helped me make the decision. I knew I wanted something with a lot of technology, I knew something where I had both a surgical and a clinical application to it, where I wasn't maybe tied to a hospital rounding, but I also had a chance to make a big difference in patients' lives in terms of their activities of daily living and the quality of life that they have. I knew I wanted to have something where I could also have a family life. My dad and mom were good parents to me, and they got to spend a good amount of time with me. And I also wanted to be able to do that for my family. And it really started to piece together that ophthalmology checked off a lot of those boxes for me. Had great mentors at Cornell. Dr. D'Amico was the chair there, still is the chair there when I was there. And Dr. Keish in ophthalmology, he's the head of the retina department there, was great to me, as well as Dr. Chris Starr, who's a cornea doctor. And they both were just happy guys that loved what they did, were passionate about what they did, and kind of shepherded me along the way. So I was a late comer in terms of getting my application together. I had done some basic science research between college and high school in ophthalmology and ophthalmic genetics over at Columbia with Alec Metz, who is a geneticist over there. But at that point, I really had not done much in terms of just basic clinical type work in ophthalmology. And Dr. Keish was great. He really set me on the course to do a couple projects. It was key to really get a good mentor there. And I had Clufus. So we kind of set up shop where Clufus was my resident. I was a medical student. I would work on something. He would edit it. And we'd show Keish. And we kind of made a good path there. Yeah. And he took first author on some things. I took first author on some things. He was really good in terms of adding that extra ophthalmology background that I didn't have as a medical student. It's hard sometimes to jump into clinical research as a medical student without an adequate background. So Clufus was great to me. The department was great to me. And then I really decided that I was going to go forward with ophthalmology at that point.
That's awesome. And I think it's really interesting because you really did have a non-traditional path at one point. I mean, going to Goldman Sachs and the finance route, I mean, it's actually interesting because I think it takes a lot to walk away from that and be like, I'm still not fulfilled. I want to do something that, like merits my own talent. So I think it's a cool story. I think it's actually something a lot of students who are out there who are maybe or applying this cycle or who are probably behind me a couple of years, I think they could take a lot away from that when they go through their clinical rotations to find something that really suits who they are deep down. And I think that kind of relates back to that too.
Well, one thing that was helpful about having some time off was just that when I went into medical school, it was less just school for me and more kind of a job. Yeah. I had seen what it was like to just have a regular corporate job, getting in, clock in, clock out, kind of very regimented. And I was able to apply that to medical school. And I thought I was a better medical student than I was college student. I was a little bit more disorganized as a college student, but having that work framework really helped me do better in medical school, I felt.
Yeah, because I mean, the work ethic, it has to be there, especially those kind of jobs too. So I think it's good. I think I always envy people who took time off to do something different because I think it's a really useful thing to have long-term for your life. So I think that makes a lot of sense to where you are and where you've been now. And speaking of such, I mean, I know you did residency at Bascom Palmer, fellowship at Bascom Palmer, and now you're an assistant professor at Bascom Palmer. So talk about that transition from being a trainee to being a fellow to being a now faculty member. And what is that, how have you grown since your time there? And talk about what the institution is like. I mean, so many of us know Bascom Palmer by name, but we don't know what it's like to be there. So if you could just talk about that, that'd be really cool.
Sure. Well, I was getting some advice from Dr. Keish and about where I should apply, and we worked on our list together. And I actually had the opportunity to do an away rotation. Mm-hmm. It was a unique experience for me because I signed up for this away rotation, but I also at that time my wife was pregnant with our first child, mm-hmm. and we didn't know really when the baby was going to come, but luck would have it, it came right when that elective rotation was about to start. So the baby was quite young when I went to do that elective, and I shortened it from 4 weeks to 2 weeks because I really didn't want to have too much time away. But at that point, John Chang, who is in retina in Wisconsin, was one of the chief residents, and his dad was also an ophthalmologist and was friends with my dad. So he was nice enough to let me stay with him for a couple weeks. And at that point, I also got to go to Bascom for the elective. And the medical school elective was awesome. It was run by Dr. Labiat, who's now our new program director. And and he had really worked hard on it. There were a lot of good didactics. There was indirect ophthalmoscope training. There was slit lamp training. And one of the most fun things was going to the ER. There was a dedicated ophthalmic ER, and I had never seen anything like that. Cornell was a great program, and there were residents who received awesome training there, but they didn't have a dedicated ophthalmic ER. So if they got consults, they had to come down to the regular ER, or they had to bring the patients up to clinic. And this was just a dedicated space where emergencies were just rolling in. So I saw the camaraderie that the residents had there. I also saw what they were able to do at that time. It was very autonomous. My medical school was much more of a hand-holding place. It was a great education. I thought I learned a lot from it, but I was looking also to kind of pivot and try a different learning style. Sure. And I saw that many of the Bascom residents had just become very independent and were independently driven to teach themselves and also learn on the go. They always had supervision if they wanted it, but they also had the freedom to kind of do what they felt was right with their own patients without being managed at every single step of the way. So the independence, the ability to have your own public health trust, patient population that was a very thankful population, patients that really needed care, that had a bad burden of disease, and also a faculty that was always very approachable and nice to the residents. I could tell just from the events there that now, unfortunately, many people who are applying are not going to get that experience. But you could tell that the residents and the attendings were very close. They were all very approachable, and they knew about your family. They asked about your family. If you had a new child, they would go and get your child a gift, and it really felt like there was a family kind of to it. So you had your family here, and you had kind of your quote unquote work family, but everything was intertwined. And they just really brought in all the spouses who are coming in there, who are disoriented, moving to a different place, maybe being uprooted from their jobs. And everybody was brought together as a family. And I really liked that when I saw it. And then another thing that brought me there was I did have an interest in retina at that time, and there was a big contingent of retina applicants in that residency class when I was going and rotating as a medical student. And I saw there was also the opportunity to stay on as a chief resident and have the retina fellowship folded in. So those were other things that brought me there.
That's awesome. And I mean, especially with retina, there's such a legacy there. I mean, you have, Dr. Flynn and Dr. Albini and Dr. Barrick. I mean, there's so many people in retina there, and obviously Dr. Shree there, who's been mentioned on almost every episode of this show because he's such a great guy and a good mentor. So, I mean, it must be so cool to be at a place where, so many advances have taken place at an institution like that. And now you're going to be responsible for kind of teaching fellows as well. So what are the challenges of a teaching fellows? Or is that something that you've been excited about doing, or what's it like to switch learning curves?
One thing they do tell you in retina is that you're really never ready when you come out of fellowship, no matter how many cases you do. And it's really not until you maybe been out for 5 years, you really start feel comfortable managing things. But as a chief resident, I had the unique opportunity to work with third-year residents and work with them on complex cataracts and lens cases and introduction to vitrectomy, buckling, things of that nature. But I also got to work with some of the junior fellows who are really learning along with me, just 1 year below me, a very low stress situation because we're both learning along the way. So I had some opportunity to go and learn how to staff. It's a very difficult thing to do. The farther you go along in training, I think the harder it becomes, because the greater the gradient becomes between how you are able to approach something and how the learner is able to approach something. So sometimes, honestly, it can be a little bit difficult to watch and difficult to let that person struggle, knowing full well that you could say something. And there's always a fine balance. You need to have the patient's best interest in mind, but also you can't just micromanage every single step. Yeah. And you need to give the learning surgeon some ability to make decisions, some ability to make mistakes, at least safely. So I had a little bit of experience doing that. I will tell you, transitioning from fellow to attending, it's much more stressful, honestly. The expectations that you set for yourself are probably higher, and also the expectations you set for yourself in terms of making a good learning environment for the fellows. In residency, the things are always kind of fed to you. The spout is always on. And Dr. Townsend, one of my mentors here, had also said that fellowship is kind of more, a give and take. Fellows need to put a little bit more in to get stuff out. And by the same token, it's tough for them. I mean, the fellows are not spoon fed as much as the residents are, in terms of cases kind of walking in there, cataracts, etc. So you feel a duty to really allow them to do a lot of the case, but at the same time, you're still learning. You're still 5 years away from what you think is going to be your maximum. So it's a balance in terms of knowing what to pass, knowing what to keep for yourself. And also, I think something that Dr. Sridhar taught me when I was learning under him was just having a lot of switches, always making the fellow never feel bad for a mistake he or she's made. Always give that person a second chance to jump in, a second chance to do something. Even on a complex case, find something for that person to do, even if it's above, even if most of the case is above that person's learning level. Maybe it's the oil fill at the end of the case. Maybe it's closure. Maybe it's putting trocars and just starting the core vitrectomy. So give them some piece of everything. And then obviously the ones that they're ready, and kind of move them along as fast as you can to let them get the most out of it. But it's really challenging.
Yeah, I bet. And one of the things that we talked about before we got on here was also the idea of balancing clinical research while being a trainee. And I know that you have some, obviously you have a lot of experience in that. So what can you guide us, those of us who are going to be applying for residency and will probably want to continue research in residency? What's your best advice for how to be efficient, productive, and come up with good ideas at the same time to lead projects that you really care about?
Sure. I'd say the first step is really determine what you like. You may A, not like research. You may B, like clinical research. You may C, like basic science research. Think about, try a little bit of everything. See what you like, kind of have a vision for what you think your future is going to be if you're going to pursue any of those tracks. The next piece of advice I would say is sometimes to get to where you want to be, you have to do some things you may not like to do.
Yeah.
And that's something I think that's difficult for a lot of people to accept these days. But sometimes, if you want to be in ophthalmology, maybe you don't like the OBGYN clerkship. Maybe you don't like the medicine clerkship.
Yeah.
Maybe you have to do some scud on those rotations, but you have to do it with a smile on your face. You have to pay your dues to some degree to be able to move on to the next step. So what I say is look to see who are those mentors going to be. Look to see what their interests are, and then find a way to work with them. Even if it's not your thing, even if you like basic science and those are mainly clinical people, do some clinical projects. If they're mainly basic scientists and you feel you're more of a clinical person, try a basic science paper. The important thing for you to do is build that relationship, because part of your application is not only going to be creating a CV where you have some research to speak of on your interview trail and to show that you've accomplished something during medical school, but also just to get a good letter and have that person be able to speak to you on a personal level.
Sure.
So that's the first thing. Second thing, something that Sridhar actually has said before, and I believe even on his podcast, is have your different types of projects. Have the short-term projects, have the mid-term projects, have the long-term projects.
Yeah.
The short-term projects could be your case reports, high probability of being published, low impact journals. Then you have your retrospective stuff, high degree of likelihood of being published, maybe a little higher impact than a case report, but lower impact than something prospective. Sure. And then have your prospective thoughts, and those prospective type of studies may be higher impact, but they may or may not get done. They may get done when you're a medical student. They may get done when you're a resident. They may get done when you're in fellowship. They may never get done, but just kind of spread out and have multiple eggs in your basket, so that not everything's going to succeed. Not everything's going to come to fruition, but you want to be able to point to a few things for your application. The last piece of advice I would say is look at your specific institution and try to determine where your competitive advantage is. If you're at a facility that doesn't really have much imaging or has maybe some of the lower, earlier generation cameras, and you see there's a facility or an institute that's publishing every single month with the highest tech imaging, and you're probably unlikely to be able to generate a publication in a high impact journal using that type of thing. But say that your program has a good microbiology lab, or say your program has a great surgical simulator and somebody who's interested in surgical simulation, then go and find that comparative advantage and really try to exploit that to the best of your ability. So really look for kind of a niche, look for something that your department or your mentors can provide that somebody else can't, and then go towards that. And then I would just say, in terms of making a good impression on your mentors, just get things done. Be timely.
Yeah.
Don't let things sit on your desk for a long time. Find a good research group. Sometimes that includes a first-year medical student, a third-year medical student, a resident, and a fellow, or some degree of that. Each person can bring different things to the table, and help each other. Put each other on help each other with projects. Maybe you play a small role in some, a larger role in the others. You write the other papers, the other ones you don't. You're just data collection. But that way you kind of build a research CV. You depend on each other and you succeed together. So develop a good research team, just like I felt like I had with Clufus and Quiche back when I was at Cornell.
Yeah, very good advice. I think the team aspect is really the exciting thing about research too, because it's really cool to get other ideas and see how different people think, and then they utilize those skills and you come together with good ideas sometimes and watch it come into fruition, or maybe it doesn't work out and you try it again next time. So I think that's a really endearing thing about research. So, Dr. Yannuzzi, you want to finish off here with just getting your advice. I know you just went through the whole transition, like we talked about, from fellowship to the jobs. So what is your advice for people who are out there, who may be residents who are listening, or even us medical students down the road? Eventually, we're going to graduate and look for where we can be employed and what we can do with our careers. So what's your advice for how to get on that transition and how to, be fruitful from that, especially during COVID-19? I'm sure it's been difficult, but, going forward, what are some pearls that you picked up along the way?
Well, I'd say one thing I noticed from being on the interview committee is that everybody is kind of biased by his or her past selections and by his or her traits that, maybe that interviewer sees in him or herself and is looking for in the applicant. So there's really no recipe, I would say, for being well liked by all the interviewers or being a top pick for each person. And sometimes, there are very different opinions in a room. What I can say is that most people are looking for fit for a program, and the interviewers, the applicants and the interviewers really can tell this quite quickly. You can kind of feel when you're in a room or feel when you're touring a place, whether it's a good fit for your learning style, whether it's a good fit for how you interact with people, what type of career you see yourself having. And I think fit was the biggest thing that a lot of people were talking about on the committee. They want to have somebody become a resident here who also really wants to become a resident here. I would say, for me personally, things that I look for are, first of all, everybody was incredibly talented. Many people had done a lot of research. Many people had done well on the boards. Many people had done well in medical school. And it's hard to look at these applications and really draw any differences between them. I don't know how many people we interviewed. I think maybe about 60, but I could have seen, just based on paper, all of them would have made great residents. One thing that I think is important for me, at least, is the work ethic. I want somebody who's willing to take a little bit extra time. As I've told a lot of the residents here, or I tell medical students this as well, the resident can be lazy in both a very autonomous model as well as a hand-holding model. In a hand-holding model, you can be really successful. You can benefit from the great teaching you have from your mentors. You can benefit from kind of better oversight, but you could also fail. You could fail in terms of not taking that extra step to think before the attending comes in the room. What is my plan? What am I going to do with this patient? What would I do if I were alone? So, there can be definitely successful people in those types of programs. There can be failures in those types of programs. Same thing for the autonomous program. There could be the resident who is taking the extra time to read about the patients, the resident who understands when he or she is in deep water and needs to go and get help and bring a case to the attending for a second look, bring the case to the third-year resident for the second look. And then there's also the resident who may just kind of breeze through clinic, there's not much oversight. People are not really looking over your back in terms of what you're doing, and maybe you're not giving the best care to your patient at that standpoint. So I think look at the learning style, see which one you fit best into. For the interviews, in terms of other things that I looked for people that had a good track record from their letters, at least in terms of facing with patients, being good doctors, being kind people, being humble people. I think humility is one of the most important things, especially when you're dealing with a sea of applicants that are all very impressive on paper. It's just nice to have people who are not arrogant, people who are willing to accept when they're wrong, willing to take a piece of advice and listen to a senior mentor. So those were important things for me. Humility, work ethic. Everybody's smart. Yeah. Everybody is good on paper. Just look for those programs where you really see a good fit, because at the end of the day, that's what the applicants and the interviewees are trying to assess is fit. They pick you to go and speak with them and to interview with them because they think, based on paper and based on your accomplishments, that you would be a good resident. And then the rest is really just to kind of gauge your fit and whether the program is really going to give you what you need to be successful as a resident.
So Dr. Yannuzzi, I know you just got off the job. I mean, you just finished your fellowship and you went through the whole job hunt process, and I'm sure that was difficult during COVID-19, but I'm sure you also picked up a lot of pearls along the way. So what can you tell anybody who's in training right now, residents or fellows, or, even future, medical students like myself who will eventually be in that position someday, who will graduate from training, hopefully. What can you give us about advice about how to find the right fit for your job and what you look for in that process?
Sure. I'd say start the process early. The process for me actually was unique in that I really thought I was going to end up back in New York. My brother-in-law and my dad were both in a retina-only group up there, and I had always thought that after I was going to finish fellowship, I was going to move up with them. At the same time, I saw an opportunity might be developing around here. My wife was very happy here. I was very happy in residency and fellowship. I really loved going to my job, and I love my mentors. So things kind of evolved a little bit, but I would say get that hunt started early. My co-chief, Nemo, he really went around and interviewed at a lot of different places. He looked at private practice, he looked at academic practices, he looked at academic private mixes. For me, it was a little different. I really only interviewed up north in New York at my dad's partnership, and then also here at Bascom Palmer. I would say think about what you want to do in terms of what type of career you want to have. Do you want to have a primarily academic career? Do you want to be in a lab? Do you want to service patients mainly? And do you want to be a high volume surgeon? Do you want to do a lot of surgery? There's not as much surgery as there used to be in retina. So generally, to do a lot of surgery, you need to be in a kind of an underserved area, or you need to see a lot of patients. And there are only certain setups that are kind of amenable to that. So think about that. Think about where your family is going to be happy. If you're starting a family, are you close to your family? Think about perhaps, is this a job that you're thinking long-term or a job that you're thinking short-term? Right now with COVID, with a lot of people coming out, there may not be that wide variety of jobs. A lot of universities are in and hospital systems are in difficult straits financially with loss of elective cases and things of that nature. So it's better to have something than to have nothing. Go and explore all your different opportunities. Sometimes the job that you start out with is not going to be the job that you're going to end with. And there's much more switching now than there used to be. I would say start those talks early. Speak to your mentors. A lot of the best jobs are sometimes not even advertised on the AAO website, on ASRS website. So speak to your mentors and also be open with them about what you want to be doing and what you're thinking, and they'll kind of guide you in the right direction. For me, I was very happy to end up staying here. I had a nice setup in terms of kind of research projects that I had already started. I could continue on with them. I knew the system. I always say to Nemo, there's a degree of excitement for him going into a new job, a completely new system, tackling something as difficult as peds retina. But then there's also a little bit of apprehension. You're going into this new system. You don't really know how you fit in and how things work there. For me, there was ease in that I knew the residents, I knew the fellows, I knew the attendings, I knew the locations, I knew the staff. So that took a lot of the edge off for me. But some of the more difficult things for me were kind of trying to find a way to transition from a fellow into an attending. I find myself always saying to my now, colleagues in the retina department, Dr. So-and-so, Dr. So-and-so, and they say, Nico, this is going to be hard for you, but you're going to have to find a way to call me by my first name. But, just, and people sometimes say that, once a fellow, always a fellow. You always want to kind of please your mentors, and rightly so. They've done so much to help you.
Yeah.
So that's kind of one of the difficulties in staying for a place for a very long time.
Sure.
I think it's important, if you do stay in a place for a long time, kind of still keep your connection with other programs. Make sure you're still learning from other people, attending conferences, seeing other techniques. Nemo is going to a different program now. He's going to be able to see a whole different way of how medical and surgical disease are approached at a different institution. For me, I'm still learning along the way from myself. I'm still learning from my mentors. So the mentorship never really stops. I still call them. I still ask questions, but I also make sure to ask other people from other programs. I call Clufus about cases, and I see how he would do things. Then I understand the Wills way of doing things, or the UCLA way of doing things. So I'd say just as you're doing with your podcast here, build a network of people that you can reach out to throughout your career.
Sure.
Beginning, middle, and end, for advice on practice building, on medical and surgical management, on patient dynamics. For me also, part of this was finding a way to build my practice, and hopefully doing it quickly.
Sure.
We're very lucky here in Miami in terms of we have a demand for ophthalmic care. So so far it's been pretty good. I've been relatively busy. Nemo helped me by sharing with me some of his patients as he was leaving, and some of the residents shared with me their patients, and just try to work with many of the other people that I knew who had stayed in the area, and that I had been a resident with. Maybe they were a fellow when I was a resident, and just kept in touch with them. So I've been able to benefit from those connections in terms of trying to build my practice a little bit faster, but it's going to take time. Had I moved had I moved up to New York, it would have taken many years to build a practice. And here I see, Dr. Sridhar started off very slowly, and now he's one of our busiest surgeons, and he has got an awesome practice, in addition to being very productive from a research standpoint. So it happens, but I would just say, the big things are think about what type of job you want to have in the future. Think about geographic location, and then rely on those mentors to build those connections to determine where the open jobs are. Sometimes when you think there's a job open, it's already actually filled. And somebody's already in mind. Sometimes when you think there's no chance at having a job in a certain institution, your mentors are going to reach out, and they're going to say, well, actually we're pretty busy. We could use somebody else to cover this office. Yeah, we could look for somebody. So explore all possibilities, keep an open mind, and know that no job is necessarily forever. It's okay if you need a change going forward.
Sounds good. Very good advice, Dr. Yannuzzi. I appreciate your time. I appreciate all your wisdom, and it's very cool to hear your journey as well. I think it's very interesting to think about the idea that sometimes we take a second chance at what we want to do with our lives, and then we find our path and we go from there. And you have a very motivational story actually because of that regard, and I think it's a pretty cool one too. So I want to wish you all the best. Stay safe down there, and hopefully I stay in touch with you, and we'll see what happens down the road. Hopefully we'll see each other at a conference or something.
Awesome. I'm hoping we're going to be able to transition away from this digital platform and eventually get back into in-person meetings. But what you're doing is great. It's a great resource, and definitely going to ease some of the tension for a lot of these this first round of applicants. It's going to be purely digital. So you're doing a great job. Keep it up. And thanks again for having me.
I appreciate it.
Good to meet you.
All righty. Bye-bye.